Hello and welcome to the clinic. My name is Dr. Hastings and I will be performing your annual physical examination today. As part of the service of our clinic, we will be performing this examination in the style of ASMR. ASMR stands for Autonomous Sensory Meridian Response, and it is the sensation of deep relaxation and sometimes a nice goosebump feeling, sometimes experienced on the top of the head, down the neck, down the arms and legs. So I will be performing your examination in this style. So that means I will be speaking softly, maybe whispering, doing some personal attention to you. So this will not be your traditional physical exam that you are used to. Okay, good. I also want to apologise for any extra sounds that may be happening. As part of the ASMR exam, everything needs to be perfectly silent and perfectly still, so it's not distracting for your relaxation. It is pouring with rain outside, so hopefully that won't distract you too much, although sometimes people who experience ASMR find the sound of the rain very relaxing. So hopefully you do too. Good. So let's jump straight in. I need to take a couple of your details, but not an awful lot because I've got some of them here. But could I please get you to confirm your name? Yes. Your age and your date of birth. Excellent, thank you. So, part of the annual physical examination, I will be asking you a series of questions just to determine the state of health that you are in now and get a little bit of your family background, any sort of family history of diseases in the family as well, any allergies, any medication that you're on, and so on and so forth. And I will also be doing a thorough examination from your head down to your toes, checking over all your vitals, making sure there's no underlying causes of any disease, any inflammation, any pain. And I will also be taking into account the answers that you give me whilst performing your examination. Okay, good. So I will start right away. How would you rate your overall health at this moment in time on a scale of 1 to 10? 1 being the worst and 10 being the best. Okay. And do you smoke? Okay. Do you drink alcohol? And if you do, how often do you drink that throughout the week? How many units of alcohol do you roughly drink on a weekly basis? Okay. What exercise do you do? Do you exercise on a daily basis, weekly basis? If so, what exercise do you do and how long for? Okay, that's good. And what is your diet like at this moment in time? Do you follow a strict diet routine? Are you lactose intolerant? Any food allergies? Okay. Yes, alright, okay, that's good. Okay. And what would you say your stress levels are like at this moment in time? Do you get often stressed about things quite easily, or are you quite a mellow person? Okay. And do you, when you do get stressed, do you have a go-to, relaxation technique that you adopt to try and help lower your stress levels? Okay. How would you describe your sleeping pattern? Do you sleep a solid 8 hours every night, or do you wake up often throughout the night? Okay. Good. Do you take any medications or supplements? Okay. And how often a day? Okay. And to your knowledge, are your vaccinations up to date? Okay. Okay. Well, that's brilliant. There are all my questions done, so thank you very much for answering them. So now what I would like you to do is to just stand over by that wall over there, over by the height chart, and I'm going to just take your height, and then if you can go over to that side of the room, there's some scales, and I'd like you to just stand on those so I can take your weight, and then I will work out your BMI, your body mass index, just to see if you are at the correct height. See if you are the correct weight for your height. Okay? Excellent. So if you can just stand over there for me. Good. And just stand up as straight as you can. Good. Excellent. Just make your way over to the scales over here. Good. Excellent. Great. You can sit back down. Good. Excellent, okay. I'll just quickly work out your BMI here on this chart. Good. Okay, so based on your height, weight and age, I would say your BMI is perfect. Okay, great. Okay, so I'm just going to put a cuff on your arm here. Good. Pop my stethoscope on. Okay. Ready? This may feel a little bit tight on your arm, but if it's uncomfortable in any way, then let me know, okay? Two, okay. That's good. Excellent. Very good. Your blood pressure appears to be normal. So that's very good. Let me just take this cuff off your arm here. Excellent. Everything appears to be normal. Now I'd just like to listen to your heart and your lungs. So with your heart, just sit normally, just breathe and relax normally. And when I check your lungs, I just want you to first of all breathe normally, and then when I ask you to, take a deep breath in and a deep breath out, okay? Great. Okay, so I'm just going to check your heart. Just checking for any palpitations, normal heart rate, Good. Everything appears to be normal, that is good. Now I'm just going to check your lungs. So first of all, just breathe normally as you would. And then when I ask you to take a deep breath in and a deep breath out, and I'll be checking each side as well as around from behind. Okay? Good. Okay, just breathe normally for me. Good. Deep breath in and out. Good. Same on this side. Breathe normally. Deep breath in and out. Good. Around the back. Breathe normally. Deep breath in. Out. Good. Normally. In and out. Good. Well, your breathing rate and your lungs seem to be clear, normal and healthy. Okay, so now what I would like you to do is to just open up your mouth and say ah. Okay, so I can check your tonsils, your throat and your tongue just to check and see if there's any inflammation there. So I'm going to be coming a little bit close to you. So just open up your mouth, say ah. Okay. Have you ever had tonsillitis before? Okay, any persistent throat infections? No. Good. Okay, everything seems to be normal. You can relax. Now I'd like to check the muscles in your face. If you can give me a big, wide smile, I'm just going to be touching your face and the muscles around your jaw, around your cheeks, forehead, and just around your throat. Okay? Good. Excellent. Just, yes, keep smiling. Good. You're doing really good. The little birds are chirping outside. They're happy the rain is over. I love the sound of birds chirping. It's quite soothing and comforting. Good. Okay, you can relax. All the muscles in your face seem to be fine. I did notice a little bit of tension in this part of your jaw. Can I ask you, do you clench your jaw? Do you find that you clench your jaw a little bit too hard? Sometimes in your sleep? Okay, well the muscles around this part of your face are quite tense. So maybe this is something to bring up with your dentist next time you see them. Does your jaw ache sometimes? Okay, I'd definitely mention that to the dentist next time you see them. Sometimes they can prescribe a mouth guard for when you sleep. So this helps you not to fully compress the jaw down at night when you're asleep, when you're not aware of it, which just alleviates some of the pressure around the jaw. Another method and a technique or treatment that they may offer you is a little bit of hypnotherapy. Sometimes the splint in the mouth guard, doesn't necessarily work because it actually sometimes encourages patients to chew on it, like I suppose a dog would a chew toy. So there are a variety of different cognitive and behavioural treatments as well for clenching. So just bring that up to your dentist as well. Everything else appears to be normal. So I will actually ask you to open your mouth once again. I'm just going to check your teeth and your gums and your tongue. I know that your dentist does this with you, but very thoroughly. I'm literally only checking to see for any signs of illness that may have presented itself within the mouth. Sometimes illnesses and other things that we may be experiencing sometimes present themselves in other ways. So I'm just going to check your tongue, your teeth and your gums. So if you just open up your mouth slightly, I'm just going to just open a little bit. Good. Have you ever had a brace or a retainer? Have you ever bleached your teeth? Okay. And how often do you brush your teeth and floss? Okay. Alright. Good. Everything seems to be normal. Great, so now I'm going to be checking in your ears just to see if there's any infection or any underlying swelling, or if your canal is blocked with earwax. If it is, I can prescribe you some treatments for that, but hopefully it shouldn't be too bad. Take my otoscope, check that the light is on. Good, so I'm becoming a little bit closer to you just to be checking inside your ears. Okay, good. If this is uncomfortable, tell me, and I'm just going to be putting a little bit of pressure on the outside of the ear as well as looking in the ear. And if you feel any pain, then please let me know, because this may be a sign of an underlying infection. Okay, good. Okay. Okay, good. Does that hurt at all? Okay. Okay. Look inside the ear now. Okay, good. You're doing really good. Okay. So it all seems to be perfectly fine. Good. Good, you're doing really good. Does that hurt at all? Nope. Okay. Just check inside the ear now. Okay, so in this ear I can see a little bit of wax, but nothing too bad. Have you ever had your ears syringed out of earwax at all? Okay, and how often do you clean your ears? Okay, no, that's fine. This ear is a little bit congested, but I can't see any sign of inflammation, or even in this one either. This ear does seem a little bit more congested than the other one, so I'd focus more on cleaning this ear a little bit better, okay? Good, alright. Everything appears to be normal. Now I'm just going to look up your nose. This is a little bit weird for some people, so I do apologise if this is a little bit uncomfortable, but all the ears, nose and throat are all connected, and sometimes you can get a little bit of infection in the nose, like rhinitis or other such things. So if I just come a little bit closer to you, if this feels weird, then I do apologise, but let's just take a look up the nose. Okay, good, I shan't be too long. This should not be that painful, but you are. Good. Excellent. Okay, everything appears to be normal. That's good. Sorry about that. And now before we move on to the eyes, I'm just going to just put a little bit of pressure along your glands, also under your armpits as well. So this is just to see if there's any swelling in the glands and lymph nodes. This could be a sign of infection. Okay. Good. Excellent. And if you can just lift your arms up like that for me. Okay, good. Sorry if it's a little bit ticklish. Okay. That's good. Excellent. Everything seems to be normal. So I'm going to get a new nib for my otoscope and we'll be checking your eyes. So within this test I will be shining a light into your eyes just to check for pupil dilation, to see if everything is functioning normally, and then I'm going to be coming a little bit closer to you just to check the actual health of your eye too. So let's just start. Good. So I'm just going to wave the light across your eyes just to keep looking forward at me. Good. Excellent. That's perfect. Okay, so the dilation of your pupils is fine. I'm just going to now come a little bit closer to you and just check in each eye. Okay. Alright. And then this side. Okay, good. Just keep looking ahead for me. That's wonderful. Thank you. Excellent. Brilliant. Good. So the eye health is good. Do you wear glasses or contact lenses? Normally. Okay, just for reading. Alright, that's fine. Okay, now I would just like you to just look straight at me and keep your head still. And then with your eyes only, I want you to follow the light. Okay, just follow the natural course where the light goes. Good. That's good. Do a little bit faster now. Good. Just keep following the light. Following the light. That's good. Excellent. Very good. When was your last sight test? Did that all come back fine? Excellent. Now I would like you to just keep your head straight at me, and I want you to tell me how many fingers I'm holding up. And I want you to just keep looking at me, don't look at my hands. Okay, are you ready? Yes. Yes. Okay, so now I would like to just put a little bit of pressure on your abdomen and just feel your liver and your bowels, just to check for any signs of hernia, any sort of swelling as well, just to check the normal functions of it. I'll also be using my stethoscope as well, just to check your bowels, but I'll do that in a moment. So I want you to tell me if the pressure that I'm putting on your abdomen hurts in any way, okay? This is very important. So I'm just going to come close to you, just put some pressure on your abdomen here, just check your liver and your bowels. Does that hurt at all? Just a bit uncomfortable, that's fine. Do you suffer with IBS? Any bloating? Okay, have you had a food intolerance test? Okay. Right, okay. It's fine. I suggest that you book in for a retest. As we get older, our body becomes less tolerable to certain foods. Okay, alright, just have a little listen of your bowels. Alright, just going to put the stethoscope on your stomach area here, just your lower stomach. Have a little listen. Okay, good. Alright, that's good. Okay, everything seems to be normal. I think the discomfort that you may be feeling in the lower portion of your bowels here, that may be a food intolerance. Sometimes when we eat wheat or dairy products, our stomach can swell and we can feel quite lethargic and bloated. So I would definitely suggest going for a retest for your food allergies, because there might be an underlying food-related intolerance. Okay? Great. So now I'm just going to test your facial sensitivity and the sensitivity in your arms and your hands. And for this, I'm going to be just touching your face and arms with this pen here. And I want you to tell me if you feel it and when you feel it, okay? Good. 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 Mhm. 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 Good. Okay, and I'm just going to put pressure on your face just here. Does that feel uncomfortable? No. What about now? No. And now? That's fine. The same on your arms. Yep. Yep. Good. 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 Okay, now I'm going to put pressure on your arm. Is that really okay? Good. So if you can just take my hand and squeeze as hard as you can. That's good, thank you. And the other arm? Yes, great, thank you. Okay. If I can just take your hand again, and I'm just going to check your nails and the skin on your hand. Our nails are very important in telling us clues about our health. Sometimes our nails can tell us if we have an underlying heart condition. On the other hand, so it's very important to check the nails and the overall condition of the hand. Good. Excellent. Everything seems to be normal. Okay, so now I'm going to be testing your hearing. when was the last time you had a thorough hearing test? Okay. Well, this won't be as intricate as that. I'm literally just going to test how well you hear on a very generalised way. So I'll be using a tuning fork just to test the sensitivity of each ear. And then I will be whispering a word in each ear. And I want you to tell me which word you hear. And then I'll be doing a variety of different sounds just to test how well you can hear them. Okay? Good. So I have my tuning forks. And we'll be using the biggest one as it's the nicest sounding one. So I'm just going to resonate this, and I want you to tell me when you hear it and when you stop hearing it, okay? Okay, good. Yeah, okay, good. The other ear. Excellent. Good. Excellent. Well done. Okay, so now I'm going to whisper and maybe softly speak a word from ear to ear, and I want you to repeat what that word was. Okay, are you ready? Camera. Good. Plant. Good. Music. Good. Birthday. Good. Stethoscope. Good. Alarm. Good. Relaxation. Good. Lights. Good, excellent. Okay, so now I'm going to do a variety of different sounds from ear to ear, and I want you to tell me when you hear them and when you stop hearing them, okay? Good. 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 That's excellent. Good. Good, wonderful. Well, your hearing to me seems to be perfectly fine, but I would go and rebook a hearing test as well, just to be on the safe side. So that is our examination complete. I think overall you are a very fit and healthy person. I can't see anything physically wrong with you, and I think that your general health and physicality is absolutely perfect, so there's nothing to worry about. But what I will do is just refer you to have some blood work done, just to test for diabetes and any underlying blood conditions. sometimes we don't know really what's going on inside of ourselves. When we may appear fit and healthy on the outside, there might be something going on the inside. So it's very good to check these things. So I'll send you off for a blood test as well. Thank you very much for coming in to see me today, and I will see you in a year's time for your next physical examination. So take care, and I will see you very soon.